Donald Trump's election to the White House could mean the end of Obamacare. One of the hallmarks of the president-elect's platform was his plan to scrap the crumbling health care exchanges. Watch.
Real change begins with immediately repealing and replacing Obamacare. In the great state of Arizona, premiums are going up more than 116%. Over 90% of the counties in Florida are losing Obamacare, and they're losing the insurers that put Obamacare there. But you know what? We're going to make it 100% of the counties because we're going to terminate Obamacare. I'm asking for your vote so we can repeal and replace Obamacare and save health care for every family in Florida.
Joining me now, an exclusive interview, former White House Office of Management and Budget Advisor, one of the architects of Obamacare, Dr. Ezekiel Emanuel. Dr. Emanuel, good to see you again. Thank you so much for joining us.
Nice to be here, I guess.
Well, last time we had a real good conversation, and I think that our viewers learned something. So I appreciate you coming back because we certainly were not finished. But let me ask you, Dr. Emanuel, for your reaction. Obviously, America has spoken. Donald Trump has won the presidency, and part of that is the fact that he wants to rip up Obamacare. It seems America agrees.
Well, look, I mean, Hillary Clinton has won the popular vote. He's won the Electoral College. We do have this unusual circumstance that America and our electoral system and our Constitution permit. Let me just say, ripping up Obamacare is easy to say. The Republicans over the last 6 years have come up with replacement ideas that they float, the most recent one being Representative Paul Ryan's proposal. The problem is they're not coherent proposals, and if you go to Donald Trump's website and look for what he's going to do on health care, he tells you he's going to replace Obamacare with something better, but we never have enough details. Before, he talked somewhat about expanding Medicare for everyone. He did say in the Republican primaries that it's unacceptable in a country to have people dying in the street because they don't have health insurance.
Right.
I have to say, I just don't know where he's going with this. You know, having insurance companies go offer plans across state lines, that's possible now. The barrier is not at the federal government. The barrier is that states don't typically want that. They like to regulate their own markets, and it's very difficult for the federal government to step in. So I'm just, I mean, part of my problem is I just don't know where he is going. And when I talk to his son-in-law,
people just want him to go somewhere and not what we have right now. I mean, let's figure out, let's consider the fact that these premiums are going to go skyrocketing next year. Just heard him talk about Arizona, up 116% in premiums in 2017.
Well,
and we saw the whole list, Zeke, over the last month in terms of all of the premiums going up across the country in 17.
Well, wait, yes. First of all, it is true that they've gone up on average 22%, not 116%. You can cherry pick anything. It is also true that in the most populous states, they're actually up less than 10%, California, New Jersey,
Why are they going
Michigan.
up at all, Dr. Emanuel? It's already expensive. A lot of individuals tell me that their costs have skyrocketed and they've got to live paycheck to paycheck now.
I'll give you 3 good reasons. One is the risk pool, who is bought into the exchanges, and the fact is we do need to expand that and get more young people as well as people at the higher end of the income. A second reason is underlying drug costs are actually going up, and that's pushing premiums up because they represent a big portion of insurance premiums. And the third reason is that the insurance companies came in. It's an early market. They mispredicted the market, and so they're raising premiums. Most experts think this is a one-time adjustment, not a permanent thing. Look, if you want to keep premiums low, what's the key to keeping premiums low? Keeping health care costs low. And that is something that has been done over the last 5 or 6 years. It's actually the case that health care costs have declined compared to where they were under President Bush.
Well,
and
that's not how America feels. They're not seeing their
I agree with you,
down.
Maria. Right, I agree with you. That's not how America feels. And part of what a new administration needs to do is to focus on the costs that Americans are feeling, drug costs and underlying premiums. And I think to do that, we need to change how we're paying doctors. That's something that the government has begun to do. It's the private sector is doing. It's unclear, again, to me, what Donald Trump's alternative is. He hasn't ever laid out an alternative in enough detail to really evaluate it.
Have you spoken to them
that,
about this? Have you
important.
spoken to Jared Kushner? Have you spoken to anybody on his team in terms of what his plan is?
I did take a flight with Jared Kushner. We did discuss health care. It was important to me that he didn't quite understand the complexity of the health care marketplace, but I would say that he did seem open to discussing it and to having ideas. Now, we'll have to see who he brings in. I mean, there's no prominent health policy person who Donald Trump has actually had around him, and that, again, is it's a complicated area, and you do need experts. You just can't say we're going to have something better without some details.
Are you saying you would like to work with do you want to work with the Trump administration on something new?
Now, look, I'm a Democrat. It's pretty unclear to me he would even tolerate me. He may listen to ideas by people. But the fact is, you know, we are one country. We are going to have to go forward. We are the world superpower, and healthcare is a big part of the economy. It's 18% of the economy. You can't ignore it. And if you want to get the federal budget under control, you do have to focus on healthcare. There's just no two questions about it.
You know,
and those are things I passionately care about.
For the American people, it's not just the cost that they're seeing. They're also seeing very few options. Look, United Healthcare said they were going to lose $1 billion on Obamacare, so they pulled out of the exchanges. Aetna pulled out most of its exchanges. Humana pulled out. So, I mean, what do you say to that? Because it's not just the cost that has been an upset to people, also the fact that they don't have any choice. And the famous quote from President Obama, if you like your doctor, you can keep your doctor. Well, actually not.
Maria, look, the reason they pulled out is that the risk adjustments that were built into the Affordable Care Act were repealed by Marco Rubio, leading the charge in the Senate. If we have those risk corridors, if we have a risk adjustment that really works, the insurance companies are going to come back in and stay in the insurance market. United Healthcare is not really to be looked at seriously because United Healthcare never really liked the exchanges, never went in. Aetna did go in seriously. I think Mark Bertolini was mad about the federal government's not permitting his merger. But I do think there are systematic things I've outlined several times, 5 things that we could do to stabilize the exchanges and to make them work better. It's always surprised me that Republicans are hostile to the exchanges because it's a Republican idea and it's a free market idea. And we need to keep those free market ideas.
Dr. Emanuel, good to see you this morning.